When the news broke that a woman had given birth to decuplets last year, it was believed to be a world record and definitely caused quite a stir. But what caused an even bigger stir than the idea of 10 babies being birthed at once was finding out that there never were any babies to begin with. Unknown to most, an uncommon condition exists that causes a woman to believe that she's pregnant, also known as a phantom pregnancy or a pseudocyesis. Pseudocyesis, yeah. And to tell us more, we have obstetrician and gynecologist, Dr. Sharon bilankulu. Good morning, Dr. Sharon, and thank you for joining me.
Good morning to you and the listeners.
All right, doctor, please explain to us what is a phantom pregnancy.
A phantom pregnancy is basically when a woman thinks she's pregnant and actually sees the symptoms that do not exist. It's a psychological condition more than anything.
So,
and it happens with women that are desperate to have children, with women that have infertility issues.
Now, how do you get a positive test with a phantom pregnancy? How does it come out that you are pregnant?
There's no positive test. Usually, there'll be the pregnancy test will come out negative, but the woman will still convince herself that she's pregnant.
Okay, what are some of the symptoms of a false pregnancy or phantom pregnancy?
Symptoms basically are something that's formulated in the patient's head. Because if you're not pregnant, if you're not pregnant, you won't have the symptoms because the hormones in pregnancy will make you have symptoms. So if you don't have those hormones in your system, it means whatever symptoms that you're having, it's something that's formulated in your head. So they'll have nausea, vomiting, that's basically not there.
So this nausea, this vomiting, this swelling of the belly, and everything else that some of the women who have had phantom pregnancies, so this is all something that is in the head and it starts showing, it starts exhibiting as a real pregnancy.
Yes.
Wow.
It's basically all, because if you think about it, if you're not pregnant, you are not pregnant. If you're not pregnant, you will not have those hormones in your system. And those hormones are the ones that will cause nausea, vomiting, and all of that. So if you don't have the hormones in your system, how can you have the symptoms? So they're basically formulated. And the sad thing is these are the kind of women who will end up going to a hospital claiming to be in labor, and they end up stealing babies from the hospitals, and this happened before.
And are there any known causes of phantom pregnancies?
It's desperation to have children.
How does the body expand if one is not really pregnant?
The fact is, when you're pregnant, there are hormones that the body will make. When you're not pregnant, you will not have those hormones. So it means if you don't have those hormones in your system, whatever, the vomiting, the nausea, it's basically like faking symptoms.
And then some people have felt movements within them and kicks, etc. How do they feel those?
With the movements, remember the person's intestines. They do what we call they basically move. You can feel your intestines moving in one point. They choose to interpret those as fetal movements when they actually not. The mind is very powerful. If you convince yourself of something, you actually think, I am pregnant when you're not.
And then how do you get rid of a phantom pregnancy? Is it possible?
How do
you get rid of a phantom pregnancy? How do you stop being pregnant after having this phantom pregnancy?
basically reiterating over and over to the woman, and also that is not pregnant. You do a sonar, show her the empty womb, which doesn't have a baby inside, give her pictures of what a pregnant womb looks like. Do pregnancy tests and send her for counseling.
All right. And any final thoughts and advice going forward?
The first thing is it depends on cultural backgrounds. In some communities, a woman is defined by having babies.
Yes.
People can look at each other just as partners. If you have a baby, it's a bonus. If you don't, it doesn't mean you're less of a woman.
All right. Thank you for your time.
You don't need to have a baby to be whole.
Yes, definitely.
And there's always an option of adoption.
Yes, thank you so much for your time, Dr. Sharon, and have a wonderful day.
Thank you so much.
That was OBGYN, Dr. Sharon Bilankulu, taking us through what phantom pregnancy or pseudocyesis is, what it is, and how it can be cured. Once again, a phantom pregnancy happens when a woman believes that she's pregnant and has pregnancy symptoms, but isn't pregnant. It's also called a false pregnancy or pseudocyesis. People also once referred to it as an hysterical pregnancy or fake pregnancy. A woman experiencing a false pregnancy may have nausea, a growing abdomen, swollen and tender breasts, and weight gain. Half to three-quarters of women with a phantom pregnancy think they feel the baby moving, and some even experience labor pains. Phantom pregnancies are rare. Estimates vary but range from 1 to 6 cases per 22,000 births in the United States. False pregnancies were more common in the past before the widespread use of ultrasounds. Interestingly, they're more common in cultures where motherhood and fertility are emphasized, like Dr. Sharon explained. In Africa, for example, the rates of phantom pregnancy are estimated at about 1 in 160. 80% of women who experience a phantom pregnancy are married, and most are between the ages of 20 and 44. It can happen at any age, though, including childhood or in the senior years. A woman can have a phantom pregnancy more than once. It can even very rarely happen to men. This is called sympathetic pregnancy or COVID syndrome. A false pregnancy and a delusion of pregnancy aren't the same. With a delusion, women don't experience symptoms. Women who have a delusion of pregnancy are mentally ill and believe that they're pregnant even though they have no symptoms. It's important for doctors to distinguish between the two because a delusional pregnancy requires different psychiatric treatment than a phantom pregnancy. So, as the doctor explained, the causes are still unknown, though experts suggest that both psychological and hormonal factors are at play. Because it's such a rare condition, there's not much data, and studies are largely based on individual case reports. So basically, the body is tricked into thinking it's pregnant, and an increase in hormones such as estrogen and prolactin lead to pregnancy symptoms. The main theories about what causes a phantom pregnancy would be a psychosomatic condition. Because of intense pressure or desire to be pregnant, a woman's brain triggers hormonal changes that cause pregnancy symptoms. And this may happen when a woman has struggled with infertility or had a miscarriage or loss of an infant or another traumatic event. It also sometimes happens to women who have an intense fear of pregnancy. Some experts theorize that abdominal growth, the sensation of feeling fetal movement, and the experience of labor pain may be due to increased activity in the sympathetic nervous system, the body's fight or flight system. Another medical condition could be sometimes a completely unrelated illness can cause elevated hormonal levels or other physical reactions that lead to pregnancy symptoms. And these include ovarian tumors, severe depression, cancer, obesity, and ectopic pregnancy. Even weight gain, constipation, or gas, when paired with psychological factors, can cause abdominal distension that a woman may interpret as pregnancy. Major depressive orders, women have severe depression or severe stress may have changes in reproductive hormones. In addition, antipsychotic medications can cause some pregnancy-like symptoms such as weight gain, loss of menstruation, and breast tenderness. The risk of phantom pregnancy is higher in women who have depression or who have lost a pregnancy, a history of infertility, a cause of abuse or current abuse, and relationship instability. For treatment, this can be devastating to a woman who thought she was pregnant, but her caregiver will show her with test results, if necessary, an ultrasound, that she isn't pregnant. The caregiver should strive to be empathetic. She might assure the patient that her belief that she was pregnant was understandable given the symptoms. All right. Once again, it is a very sensitive issue, a very sensitive topic to discuss. And ultrasounds do help with, breaking down the news that one does have a phantom pregnancy and is not really pregnant. It is 11:19. You are listening to the Mid-Morning Talk on Salam Media. We will be right back after the break.